Let me ask you something really quick, and I want you to think honestly about your answer. When was the last time you actually checked your blood pressure and felt confident you understood what the numbers meant? Most people look at that reading, see a couple of numbers, and either shrug it off or quietly start worrying. And here's the thing. If you're an adult over 50, there's a very good chance the number you've been told to aim for your whole life may not actually be the right target for your age anymore. Not because something is wrong with you, but because blood pressure isn't one size fits all. And a lot of adults over 50 are either over-treating or under-monitoring based on outdated advice. Before we get into the charts, let's do a quick check-in together. Think about your own history. What was your last reading, and where are you on the age scale? Go ahead and drop your age and your most recent numbers in the comments below. It helps us build a genuinely supportive community here, and it helps me shape future content around what you actually need. By the end of this video, you're going to know exactly what your numbers should look like, whether you're in your 50s, 60s, 70s, or beyond. You'll know what's genuinely healthy, what needs a doctor's attention, and what daily habits actually move the needle. So grab a pen, jot down your age, and let's get into it.
Okay, first, I want to bust the biggest myth in blood pressure advice. And that myth is this: 120/80 is the perfect number for everyone. You've probably heard that number your entire adult life. And for many younger, healthy adults, yes, it's a great benchmark. But here's what a lot of people aren't told. As we get older, our arteries naturally become a little less flexible. That's just biology. And because of that, a slightly higher systolic reading, that's the top number, can actually be completely normal and appropriate for someone in their 70s or 80s. Some older adults who aggressively chase a young person's blood pressure target can actually end up dizzy, lightheaded, or at a much higher risk of falling because their blood pressure has dropped too low. So the myth isn't that 120/80 is bad. The myth is that it applies equally to someone in their early 50s and someone in their mid-80s. It doesn't. And today, I'm going to show you what the ranges actually look like, decade by decade. Before we get to the chart, let's just make sure we're on the same page about what these numbers actually represent, because a lot of people aren't totally sure, and that's completely fine. When you get a reading, let's say 128/78, that top number is called your systolic pressure. That's the force your blood puts on your artery walls every time your heart beats. The bottom number is your diastolic pressure. That's the pressure that stays in your arteries when your heart is resting between beats. Think of it this way. The top number is your heart working. The bottom number is your heart resting. Both matter. But after 50, most cardiologists pay closest attention to that top number, because that's where the most meaningful cardiovascular risk information lives. Managing this number consistently is one of the most important things you can do for your long-term heart health. All right, here's what you've been waiting for. Let's go through the chart decade by decade. We'll start with adults in their 50s. In your 50s, this is really the decade where habits set the tone for everything that follows. An ideal reading sits between 110 and 129 on top and 70 to 79 on the bottom. Now, if you're sitting at 130 to 139/80 to 89, that's not a 5-alarm emergency, but it's absolutely worth a conversation with your doctor, especially if it's consistent. And anything at 140 or above on that top number, that's a conversation you want to have sooner rather than later. In your 60s, a slightly wider ideal range opens up: 115 to 135 on top, 70 to 80 on the bottom. Here's something important I want you to hear. One reading doesn't tell the whole story. I've seen people panic over a single high reading at the doctor's office. And honestly, white coat anxiety is real. Being in a clinic can push your numbers up by 10 to 20 points just from nerves. What matters is the pattern, what your readings look like consistently over weeks and months. Now, here's where it gets interesting, and where a lot of people are genuinely surprised. In your 70s, a systolic reading between 120 and 139 is considered a healthy range. That might be higher than you expected. And that's because, as we age, our arterial walls naturally lose some elasticity. It doesn't mean something is broken. It's a physiological shift that happens to most of us. So a reading that might have raised a flag at age 45 can be completely appropriate at 75. That said, please don't use that as a reason to stop monitoring. The range is wider, but your attention matters even more. For adults over 80, the approach actually shifts quite a bit. Most physicians at this stage aren't chasing a perfect rigid number. They're balancing 4 things at once: preventing stroke, protecting the heart, reducing fall risk, and preserving quality of life. A systolic pressure anywhere between 120 and 145 can be acceptable, depending on that person's overall health, their medications, and what their doctor knows about them specifically. This is exactly why individualized care becomes so critical at this stage. Your neighbor's target might genuinely be different from yours, and both can be completely right. Here's a second thing most people don't think about, and it's actually one of the more common issues I see overlooked. Everyone worries about blood pressure that's too high. But what about blood pressure that goes too low? For adults over 50, blood pressure that drops too low, especially when you stand up quickly, can cause dizziness, blurred vision, and a real increase in fall risk. This condition is called orthostatic hypotension, and it's more common than most people realize. Yet, it often goes completely unaddressed. If you've ever felt that head rush when you stand up fast, that could be a sign worth mentioning to your doctor. The goal isn't just lower blood pressure. The goal is healthy blood pressure. And that means not too high and not too low. Now let's talk about what you can actually do, because information without action doesn't help anyone. These are 5 habits that genuinely move blood pressure in the right direction. None of them are extreme. All of them are completely sustainable. Walk daily. Even 20 to 30 minutes a day makes a real difference over time. Consistent low-impact movement naturally relaxes blood vessels. No gym required. A walk around the block counts. Cut processed sodium. Most sodium isn't from your salt shaker. It's hiding in packaged and restaurant food. Read labels. That's where the real therapeutic impact is. Prioritize sleep. This one doesn't get nearly enough credit. Poor sleep consistently drives blood pressure higher. Even 1 extra hour of quality sleep can show measurable improvement within weeks. Number 4, stay hydrated. Dehydration makes blood pressure harder for your body to regulate. A good target for most adults: aim for 6 to 8 glasses of water a day, adjusted for your activity level and the climate you live in. And number 5, even modest weight loss helps significantly. You don't need to lose 50 pounds to see a real change. Losing even 5 to 10% of your total body weight, if you're carrying extra, can meaningfully reduce the physical load on your heart. Before we wrap up, I need to be completely direct with you about something, because this information could genuinely save a life. There are situations where high blood pressure stops being a "let's monitor this at home" situation and becomes a "call for help right now" situation. If you have high blood pressure readings and you experience any of these symptoms — chest pain, sudden weakness in your face or arms, difficulty speaking, a severe headache that feels completely different from your normal ones, or sudden vision changes — please do not wait. Get help immediately. These symptoms together can point to a hypertensive emergency, a stroke, or an acute cardiac event. None of them are "maybe I'll check again tomorrow" situations. Okay, let's bring it all together. If you're an adult over the age of 50, your blood pressure remains one of the most powerful predictors of what your next decade looks like health-wise. But the most important thing I hope you take from our discussion today is this. You're not chasing an artificial, youthful, perfect number. You're looking for a healthy, stabilized range, one that's exactly right for your age, your unique clinical history, and your life. If this video helped you understand your blood pressure a little more clearly, go ahead and hit that like button. It genuinely helps this channel reach more people who need this kind of practical, evidence-based information. And make sure you subscribe if you want more research-backed health and wellness content made specifically for adults over 50. Thank you for watching. Look out for your health, and I'll see you in the next one. Take care of yourselves.